Hello, my name is Alison Schofield and I'm a tissue viability nurse working within the NHS. Together with Eleanor, we have produced some short videos to assist in the self-management of lower limbs and leg ulcers. This involves skin care, how to apply a dressing and how to apply different compression systems. So now we've given our leg a nice wash in the bowl of water, we want to pay particular attention to areas in the wound bed itself and to the surrounding skin. Okay, so we can see on this wound here, in the centre there's the what we call yellow slough, which is just wound debris, and it's quite common in chronic wounds to build up. But to give the wound a better chance of healing, it's quite good to try and reduce the slough down. And we can do it through various types of dressing, moist wound healing, for example. That's where we put the dressings in place to cover it up. And also there's parts of the cleansing process which we're going to demonstrate now, which will also help to reduce that down. Now around the wound, you can see down by the close to the ankle area, there's a build-up of thick dry skin. Now we call this hyperkeratosis, and it basically just means that the layers of skin have built up over the time. They can become quite thick and stubborn, and if they crack, they can be prone to infections. So we want to also try and tackle the areas of dry skin. Simple washing might not be able to do that, so we've got a trick for you. So what we're going to use is called a debris soft pad. Now this is a monofilament pad. So what I've done is, so it comes in the packet, open the packet and just put some tap water to moisten it. So it's not saturated, it just moistens the nice soft fibres of the pad. There's a little pouch so you can put your hand in there nicely, so that makes it nice and easy to use. You can do it yourself or you can get somebody else to do this for you. So the way it works is we just want to use circular motions onto the skin, and then that will help to keep the skin nice and soft, and it will remove any dry skin or debris. Okay, so I'm going to tackle the thick, dry hyperkeratosis skin that we've got down here. And you might need to give it a couple of minutes. There's no restriction on time, and really to tackle these stubborn areas here. There we can see there's some coming away there. Lovely. Might not all come away in one go, so if you do this each time you do your dressing change, do your skin care on your leg, then it will help with that. So the wound centre itself, so I'm going to do the same there. Now this is a very soft pad, it may cause a little bit of discomfort because wounds can be painful, but it's not designed to be a painful tool in any way. Okay, so we're going to do the same there, and we're just going to get away there. That's coming away nicely, some of that thick slough we can see. So the pad we're going to dispose of into our bag like we do with the dressings, and then that can go into the rubbish. So now we're all ready to apply our emollient and then to redress and reapply our compression.